Hi, welcome to the Wellness Money Talk. I'm so excited today. This is our first episode since we've changed our name. We went from calling our podcast Wealth Day to now calling it Wellness Money Talk. And that was very important because I felt like I had a lot to say about your wealth and your health. I believe they're linked. It's not just the slogan we all hear, your health is your wealth, but it's literally your health is your wealth. And so I wanted to create this environment where I'm not only just talking about how to get to the bag, but essentially how to also maintain your health so that your bag lasts a long time. Now, keep in mind, yes, I am a trained pharmacist, but I'm also a trained financial professional. And I felt that I was doing a disservice for just talking about one part with the money and not talking about how to actually keep your health to get to that money. And so a little story here. So growing up, I grew up with my dad, and we had a very, I love my childhood. Like, I have no complaints, right? But, and I grew up with a single father. So towards the end of his life, he passed away from cancer. But towards the end of his life, that toll of cancer, it was months and months of misdiagnosis. They told us he had this and it was something else. But those months were so long because we literally were seeing his life just fade away before they finally figured out it was cancer, and he was already stage 4. And so if you know anything about cancer, if you don't know, there are 4 stages to cancer, stage 4 being the highest. And whenever you get diagnosed with that stage 4, it means you have just about a little bit before, you transition out of this world. In my dad's case, they told us it was 6 months, but it actually ended up being just a few weeks. In fact, the same day I found out he had cancer and it was stage 4 was the same day within like an hour span that I got a call saying he had passed away. So I was taking my exams, trying to finish out my third year of pharmacy school so I could, we take this exam where it lets you get so you're able to go on your rotations for your last year in pharmacy school. So I guess nobody wanted to really let me know what's going on. They just wanted me to focus on my exams. And so I spoke to my dad that morning in his sick bed. He prayed for me and everything to go, take this exam while I'm praying back for him about his health. And I finished that exam that day. I was so happy because I passed. I was like, man, I can't wait to, tell my dad in the morning. And within that time frame of thinking about, I passed my exam, and then being called, and I was like, hey, let me tell you about what's going on with daddy's health. And me, like, oh my God, he has stage 4 cancer. Like, everything was going on at the same time. Within 30 minutes, we got a call because he was outside the country. We got a call saying, oh, by the way, I'm sorry, but your dad just passed. So essentially that, so if you look at it, that's kind of like has been my background of like, I wanted to be a health professional. I wanted to help people with their health, but then I also turned around and started looking into finance aggressively. I've always been interested in finance. I've always had a passion for it, but I was more concerned about helping people with their health and their wellness and just doing that using pharmacy. So when my dad was sick during that period, it took a lot of finances, especially cancer, because you're dealing with a lot of stuff, right? Especially because he was misdiagnosed. So he ended up doing surgery. He ended up staying in the hospital for months on end. He lost a lot of weight. He was so emaciated, I couldn't even recognize him the first time I had seen him after I flew back home to go be by his side. So all his savings, everything was gone. So if you think you're trying to work and get your wealth up or your net worth up and you're not concerned about your health, keep in mind anything can happen in regards to sickness that could come and wipe out all that thing that you've been building. So first, get to make sure your health is in check so that whatever you build in, whatever kind of financial nest you're building, doesn't end up going towards your health at the end of your days, So that's why I wanted to focus this podcast now on talking about both health and finance. I've been given the privilege of being able to be well versed in both of them. So if you subscribe to this channel, make sure you subscribe. You're going to be getting the benefit of both. But this season on the podcast, I want to start focusing really well on wellness and the importance of that. Recently, I became a certified functional medicine practitioner. Yay! And so what that means is I help people find the root cause to their illness, and I implement holistic ways or alternative medicine, or you could say natural ways, without using, medications or drugs to reverse their illnesses. So I'm focusing on women's health, specifically women who are suffering from polycystic ovarian syndrome, PCOS. And you're going to be hearing me talk a lot about that. And so just me being a woman and my history of I've had like a very rough history when it comes to women's health, from just, having very severe menstrual cramps that would have me rolling on the floor and throwing up, to, having extreme hormonal imbalances with cystic acne, and then also suffering from just miscarriages, multiple miscarriages. And I'm like, what is going on? So I had to figure it out for myself. I had to heal my body. I had to figure out why my hormones were imbalanced. I did that, and I want to do it for other people. So functional medicine has come into my life, and I'm so excited, and I can't wait to help other people figure it out. And it takes into consideration, what is the root cause? Why are you having this illness? And it could be any kind of illness. It could be diabetes, cancer, women's health, men's health, hormonal imbalance. I've seen people doing it for thyroid, autoimmune disorders. I've seen people taking care of menopausal women, hormonal imbalance, hormonal replacement. I've seen it could be in any aspect of any kind of illness, even Alzheimer's, dementia, and I'll explain further why everything starts from one place in our body. If you know that secret, you're going to be able to take care of a whole lot of things going on in your life. And just people around you. So if you have a parent that's ill, a grandparent, or a child, or someone else around you, these are strategies and these are protocols that you can implement to reverse it, or get someone that is actually a practitioner of functional medicine to help you do. So I'm really excited about that. And so you're going to be hearing me when I talk about wellness and different things. It'll be focusing on using functional medicine protocols. Now, for people out there that are like, okay, functional medicine, how can I become a functional medicine practitioner? Do I have to go to school? What do I have to do? So as a healthcare professional, most of us it's something we've been taught already in school in different aspects. But if you actually get trained as a functional medicine practitioner, it takes into effect a very organized way of delivering those protocols, where you gather information, you search their history. And the reason why it's different from a regular conventional doctor or medicine practice is because it's taking deep account of the person as a person. It's customized healthcare. It's not just everything goes and I take care of you in 15 minutes, I'm off to the next person. It's removing the barriers like insurance to focus on that person as a person and why they're going through what they're going through, right? So a person comes to me, I'm looking at their history, personal history, social history, environmental history, what has been going on in their life, in their parents' life, what do they do? What occurs every day, every month, every week? What things do they notice? And I'm looking from top to bottom, inside of their bodies. Do they have any kind of infections that might be causing it? Is it gut health? Is it brain? Is it mental? Is it hormonal. So all those things, I'm considering it. And so this is not just a one pager talking about, does your mom smoke? Does your dad smoke? Is your dad alive? Is your mom alive? This is going into deep history, because that history gathering, that information helps me and helps, other practitioners kind of focus on, okay, now we can find what the root cause is. Now we can see where the problem is coming from, and then we can implement, changes. And so I'm really excited about this, and I'm really excited for y'all to hear more about this. And we're going to take a break right now, and we'll be back. And we're back. This is the Wellness Money Talk with your hosts, Dr. Ndidi Ihim. And we've been talking about functional medicine, what it is, why it's important to maybe look for someone who uses that practice to reverse your chronic illness. And one of the questions I normally get a lot from people is they want to understand, so if you're telling people you reverse the chronic illness, right, the chronic disease or whatever it is, how long does it take? So usually with functional medicine, because it really is a lifestyle change, you're changing a lot of things about the way you normally do things in your life. You want to give it about 6 to 12 months to see, a real result, to make sure that you really are in that habit of your new changes, right? Usually within the first 3 to 4 months, you will start to see changes if you stick to the plan and you don't deviate from it. But for a long-lasting result, you want to give yourself about 6 to 12 months. And so, will I recommend functional medicine to anybody? Yes, absolutely. People, sometimes they research stuff and they're like, wow, functional medicine, it costs a lot of money. But think about it. In the long run, what does it cost you? Is it costing you your health? Is it costing you time spending with family? Does it cost you time you could have gone out, seen people? Is it costing you your confidence, your mental health? So what does it cost you in the long run? And really, if you add up the money and the priceless moments that you could have spent with people, if you didn't have whatever it is you're going through, illness, it costs you more not implementing functional medicine strategies than it will if you did. So, if you're going through any kind of chronic illness and you've tried so many things and you're like, let me try the holistic approach, I would say reach out to a functional medicine practitioner and see how they could help you. Better still, join my text community. Text wellness, text the word wellness to 832-400-6829. And let me see how I can help you. And if I can't help you, I definitely know people who can. So I don't want you to go about, life confused about, what it is. Where can I find a solution to what I'm going through? What is the root cause? Keep trying the same things over and over and over again, and it's not working. It's time to change, So I just really wanted to kind of spread the word about functional medicine and why I like it and what it's done for me, and help other people out there. So text that number if you have any questions. I want to talk to you. I want to answer your questions. Let's see how we could get on a call. And in the meantime, I want you to really stay true and stay safe. And I wish you the best in your health, in your wellness, in your wealth building, everything that it is you're trying to accomplish that makes you feel like a whole person, like a whole individual, a whole human being. And so I think it all centers in your health and your finances. You figure out how to reduce money stress, it tremendously boosts your health. And you figure out how to stay healthy in the long run, it helps you earn more in the long run. So until next time, this is the Wellness Money Talk podcast, and I am your host, Dr. Ndidi Ihim. Talk to you later.